In a time of great global uncertainty, what matters most is clearer now than ever before. Health matters, older adult matter, science and especially geroscience matter.
From the USC Leonard Davis School of Gerontology, this is Lessons in Lifespan Health, a podcast about the science and scientists improving how we live and age. I'm Orli Belman, Chief Communications Officer. Lessons in Lifespan Health is supported by the Ney Center for Healthspan Science. On today's episode, Dr. Pinchas Cohen discusses COVID-19 and how research focused on delaying aging processes holds promise for improving outcomes for older adults. Cohen is Dean of the USC Leonard Davis School and a professor of gerontology, medicine, and biological sciences. He is a leader in the field of geroscience, an emerging area of research that aims to help people grow older in better health by slowing the molecular, cellular, and biological processes that lead to age-related diseases like diabetes, lung, and cardiovascular disease. In the case of COVID-19, it is clear that the prevalence of these underlying conditions is part of what makes the disease deadlier for older adults. Dean Cohen is speaking to us today to explain how geroscience and gerontology can benefit older adults in the battle against COVID-19 today, as well as improve overall health for people of all ages going forward.
We've been advocating for all of the topics that are front and central to the current crisis: senior housing, overcoming social isolation and loneliness, extending health span, geroscience, including things like reversing immunosenescence, which is a key reason why older adults are so affected by this disease. The issue of health disparities, why some groups are more dramatically affected with than other groups, even in the same age categories. And this area that we sometimes call inflammaging, that Tuck Finch started talking about decades ago, which is a key reason why people die from COVID-19. Older adults are so much more dramatically affected by this terrible pandemic. While, of course, middle-aged people and young people are affected by this, and their rate of infection can be very high, the mortality of younger people is very, very small, but rises dramatically as people age. This is a very sobering statistic that, of course, this is temporary, but right now, COVID-19 kills more people than any other cause. And these people are our constituency. They're older adults.
Cohen says developing a vaccine is critical, but so is ensuring it is effective for older adults.
We all know that vaccines is the number one goal for the biomedical industry right now. But some of you may or may not be familiar with the fact that vaccines are extremely efficient in young people. But among older adults, the response to vaccination is sometimes very ineffective. For example, flu vaccine has a non-responsiveness rate that approaches 50% in older adults, which are, of course, the group that needs it the most. There have been some studies among the biogerontology community to use things like rapamycin, which is a drug that is an anti-aging drug, but also acts on immunosenescence and improves the response to influenza vaccines. There's going to be a major focus in coming months and years on developing even better vaccine enhancers to improve the response to the vaccines that are going to be appearing in about 9 months. Of course, we all need to use prevention measures like masks, sanitizers, and so on.
He says testing and treatments are crucial as well.
And already many groups are working on that. But variety of pharmacological treatments, both in terms of boosting immunity, acting as antivirals, are being tested and developed, as are medical devices. But most importantly, when people look at what actually causes people to perish from COVID-19, it's not so much the viral pneumonia that they suffer from, but rather something known as a cytokine storm, that the body responds to the virus with this secretion of inflammatory cytokines like something called interleukin 6 and TNF alpha and interferon, which the body then responds to with really shutting down of the lung and eventually death. So the development of blockers of this cytokine storm are going to be critical. And that's an area that geroscience has been leading for many years. And finally, survivors of COVID-19 are already projected to have a variety of sequelae, including lung fibrosis, dementia, and cardiac conditions. And developing treatments for these, particularly in seniors, is going to be a key goal for the geroscience community. So we have our work cut out for us.
Cohen believes the school and the field are up for the challenge.
Post-COVID-19, I think that gerontology education will only become more important. Furthermore, research on the policy and social impact of the pandemic will be prioritized. Our leaders, our thinkers will continue to be at the forefront of that. Research into geroscience, particularly immunosenescence and inflammation, will be a major goal for the National Institutes of Health. Prevention of chronic disease, which has been really the biggest risk factor for older adults, will return as a national priority. And all of the things that we were saying 6 months ago about how the national healthcare system could go bankrupt if we don't do something about dementia and Alzheimer's disease, how we need to plan for senior living, all of this will remain an even bigger priority.
We asked Dean Cohen to put on his professor hat to provide a primer on just what COVID-19 is and to explain what factors place people at greater risk.
So viruses are as old as life and have been around for billions and billions of years, and they co-evolved with other forms of life. And coronaviruses are very ancient and have been infecting animals and humans for many, many millions of years. SARS was the first coronavirus that really came to the forefront of the recognition of both the public and of infectious disease experts. Fortunately, the first SARS epidemic was quite limited. And one of the other name for COVID-19 is SARS-CoV-2, because it is a virus that's similar to the SARS virus. And these coronaviruses are very common in a number of different animal species. Bats are, of course, been blamed for this and previous epidemics. And for some reason, bats harbor large amount of viruses while still living a normal life. So the word novel means that it hasn't been previously documented. And the coronavirus is basically a name that we give to a family of viruses that have this crown-like appearance. And there are several that have been recognized without causing major illnesses in humans, except for SARS and COVID-19 or SARS-CoV-2. Importantly, people have started doing research on SARS viruses, coronaviruses, even before this epidemic. There's a German group and a different group in Israel who've been working to develop vaccines and treatments against coronaviruses over the last several years. That put them ahead of the competition in terms of being competitive for the first vaccine development for next year. So the coronaviruses are quite different from influenza viruses. They're biologically unique, very separate. Also, influenza viruses affect primarily the airways, while coronaviruses can attack various parts of the body, but they're deadly when they end up attacking the lungs, which influenza does not. Influenza predisposes the lungs to bacterial infections, which could be lethal, but they're quite distinct. So that's why there are limited lessons that we can learn from influenza when it comes to COVID-19. But we do have enough previous knowledge to allow us to deal with this crisis and for future crises. There are three phases in this disease. The first is getting infected. The second is getting symptomatic disease. And the third is being severely ill and possibly dying. Each of these is subject to a completely different set of determinants. So when it comes to getting infected, the number one determinant is the ability to practice social distancing and prevention methods. So why have we done so much better in California than New York? It's because we live in a more spread out environment. New York is so packed with people. That's why they had the worst outcome in the world. Whether there is some kind of a susceptibility to getting infected is unclear. Young people get infected just as easily as old people. The difference is that many young people have a completely asymptomatic course, that they're able to have the virus go through their system, develop antibody, and never have any sign or symptom. The genetic determinants of who's going to get illness, as opposed to who's going to remain asymptomatic, is something that we totally don't understand. Obviously, having poor health is important, being a smoker, but there's also going to be genetic reasons why some people develop or don't develop severe disease. And then whether or not you're going to survive, be really sick and get better, whether you're going to have a very, very bad outcome. Again, age is an important determinant. Underlying disease is an important determinant, but undoubtedly genetics is important. We already know that African Americans are far more likely to die once they get into the ICU than whites, for example. And there may be a genetic reason for that. We don't know. There could be other factors. But there are many, many different steps in the process of being ill with coronavirus that we need to learn more about.
The pandemic has put priorities in focus, and Cohen feels optimism that research will reveal some needed answers.
In a time of great global uncertainty, what matters most is clearer now than ever before. Health matters, older adult matter, science and especially geroscience matter. I think that this is going to be a challenging year ahead of us, but together we will prevail.
That wraps up this lesson in Lifespan Health. We'd like to thank Dean Pinchas Cohen for his time and expertise, and all of you for choosing to listen. Please subscribe to our podcast and learn more about us at lifespanhealth.usc.edu.